This is WCNY's The Capitol Press Room, and we're highlighting legislation being championed by the association representing retired public employees who want to ensure their members aren't seeing a diminishment in their health care benefits when they enroll in Medicare, specifically as it pertains to their access to a skilled nursing benefit. For more on the issue, we're joined in the studio by RoAnn Destito, the former commissioner for the State Office of General Services and now the board president for the Retired Public Employees Association. Thanks for joining us in the studio.
Thank you for having me.
So, first of all, for the uninitiated, what constitutes skilled nursing care, and what sort of skilled nursing coverage are retired public sector employees traditionally entitled to, at least before they are Medicare eligible?
Okay, so skilled nursing care is you have a stroke and you're hospitalized, and you have to go into some kind of rehab program. So you usually go into a skilled nursing facility for the rehab, and it could, your healthcare provider will determine how long your rehab will take. So if I am an active employee and not on Medicare, NYSHIP provides 120 days of skilled nursing facility services. I am a retiree now, and I'm Medicare primary, which the state has put all of our retirees on Medicare primary, NYSHIP, or whatever supplement you have. And now it becomes 20 days with a requirement of a 3-day hospital stay.
And what's wrong, from your perspective, in changing the benefit? I mean, if I'm the state, I say, okay, I get to save some money and the retired employees still get 20 days.
So this is about equity in retirement. First of all, public employees, whether they're on the state payroll or local, because we advocate for both state and local employees, retirees. It's about equity. It's about not having the erosion of your pension and the cost of health care eat away at your pension. So health care is, as you probably know, is increasing at a very high rate. So it's beginning to diminish the benefits that many of our retirees are having in their retirement.
Well, yeah, what has been the practical effect of this? I mean, is skilled nursing care something that people regularly rely on? Is this an issue for a lot of public retirees, or is this something that is really a niche benefit and is only impacting, say, a small subset?
It's not a niche benefit. It's a benefit that when you need it, it needs to be there, and it can be very costly if you have to pay for it after 20 days. So we don't have a number that we know how many people, but we have had examples of people having to pay after 20 days, and it's costly.
So looking at the pending legislation, it looks like it simply prohibits a rollback of the skilled nursing care benefit. And while the fiscal note, like many fiscal notes here in Albany and the bill memo, says the cost to the state is TBD, I've seen the price tag estimated around $30 million annually. Why should the state take on that cost? You said equity. Is equity worth $30 million a year?
Well, equity is worth it if you're going to support a public employee who dedicated their lifetime to serving the people of the state of New York. And also, when you need this care, it's going to cost you. So it's a something that you had in active employment, and when you retired, you lost it. And that's not what we want to advocate for. Equity and making sure that your retirement is not any different than what was promised to you when you became a public servant. And I will say that, public service are people who dedicate their lives to the state of New York or their community, their municipality, and they haven't always been given the benefit of high wages. So these benefits were given sometimes in lieu of an increase in payroll, in compensation. So we want to keep our retirees where they were when they retired. And I think the other thing I want to say is that, you know, some of our retirees are accessing HEAP, they're accessing SNAP. I mean, they're accessing other programs that cost the state money also. So why not make sure that they're given, you know, the COLA or the health benefit that they need when they retire?
You referred to the health care benefit as something that was promised. Is this something that is collectively bargained and is in contracts? Is there some statute that says
Yes.
you need to continue to have this skilled nursing benefit?
It's a negotiation, yes.
And so,
And it was promised, yes. And it was promised back in the early 2000s when the state of, and I was a legislator back then, it was promised that when we made retirees Medicare primary, which saved the state a lot of money because then the premium for the health care benefit was now pushed to Medicare. So our employees became Medicare primary, and then NISHIP is secondary. So or whatever plan you have
Sure.
that supplements.
So if this was something that was negotiated already and the state is theoretically reneging on an agreement, why isn't this something that is being addressed in court?
Well, in some places it is, you know, some of these inequities are being addressed in court. We haven't chosen to go to court. We would like to negotiate
Why?
with the legislature.
Because you've had the bill vetoed in the past. It seems
We had the bill vetoed because it was outside of the budget.
Sure.
We're trying to now work within the budget. We're also trying to make sure that we have accurate numbers. I think the numbers that are being thrown around, and I'll use your term that, you know, the fiscal numbers are anywhere they want them to be. So I think we would like to get an accurate amount. We'd like civil service to work with us and tell us what they're estimating the use of this benefit.
But why not pursue a legal action at the same time, have it hanging over the head of the governor like the sword of Damocles? It seems like it might strengthen your bargaining position.
Well, we'll take that advice.
Well, I don't think you need any advice from me because you've done, as you alluded to, a tour of duty in the assembly. You've done experience in the executive branch. And with that background, I'm curious, why does this seem like the type of thing that a governor, this governor, and I have to imagine her predecessor would have had no problem vetoing it? Is this about the retired public employees and their strength in Albany? Is this about what people are willing to sign or veto outside of the context of the budget? Why do you think something like this is always ripe for veto?
The only time we have had this passed in both houses and vetoed is outside of the budget.
Sure.
So we are working actively. I'm here for 2 days to, you know, this week trying to speak to some of my old colleagues and some of my newer colleagues about, you know, this bill. This is a number one bill, among some other things. But this is an equity, and I think the estimate, we're going to meet with DOB. I would like to talk to, you know, DOB about, you know, where this number's coming from. I have suggested that we possibly do a study bill where they actually study the costs.
I recommend putting money aside for that study bill. Otherwise, they're going to veto that too.
Right, I know.
And what's it like coming back to Albany after now, I think, 15 years since you've been out of the assembly? I mean, do you see a lot of familiar faces, or has there been so much turnover?
Well, I walked into the chamber for the first time, and the majority leader introduced me, and I knew a lot of people because I still was commissioner.
Sure.
So I knew the members, and, you know, they would come to me on occasion for different things as commissioner. So some of my old colleagues are still there that I served with, and some of the newer ones that I learned, you know, that I met when I was commissioner.
Hopefully you took care of them as OGS commissioner.
I sure did. I tried to.
Well, we've been speaking with RoAnn Destito. She is the board president for the Retired Public Employees Association. RoAnn, thank you so much for joining us in the studio.
Thank you for having me.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.